My name is Ehsan Shiraz and I am a trauma and orthopedic consultant, and this is a patient information video about the common injuries that you see in the knee. So to explain these injuries, I've got a model with me because the knee is a very complex joint. So if you look, this is what the knee looks like from the front, from the side and from the back. Starting from the front, you've got the kneecap. It actually rubs or stays in this little groove, which is called the trochlea. Lots of athletes, ladies, teenagers, sometimes get patella dislocations. Basically what happens in simple words is that the kneecap slides and sits on the side, thus causing a lot of pain and discomfort, and then the patient sometimes can push it back or we can push it back. Again, if you get this, it's a very complex topic, which probably I'll do another video on, about all the things that can be done to fix this. Moving on from the patella, if you look at the side of the knee, you can see one ligament here and one ligament here. Now, these two ligaments are providing support to the knee to prevent the knee from opening up on either way and stopping that movement. So imagine a rugby tackle or a football tackle where the knee is really tackled hard and it opens up like this. That would tear this ligament, or if it opens up like this, it would tear this ligament. This ligament doesn't necessarily always require surgery, and depending on your presentation, condition and how bad the tear is, then we can advise treatment for that. Moving on, if you open the knee, inside the knee, you can see that there is this ligament right in the middle. Now there's two of these, one in the front, one at the back. These are called the cruciate ligaments, so because they look like a cross. These ligaments usually tear in athletes, sportsmen, classically footballers. A lot of famous footballers have had this injury. What tends to happen is the job of this ligament is to provide anterior-posterior stability in the knee. So if you've lost the ligament, you lose that stability, and hence why the patient will present with a classical story of, oh doctor, when I walk, my knee gives way. Or whenever I'm going to go for a tackle in a sport, I feel as if my knee is just gonna buckle underneath me. Again, the treatment for this is bespoke depending on the patient. Again, not everybody requires surgery, but the ones which require surgery, the surgery for this is brilliant and gives you very good results. As you can see, most professional footballers have actually gone on to play Premiership football even after having this surgery. And then moving on, there's another injury you can get in the knee, possibly the most common injury in the knee. If you open the knee and look inside, there are two ligaments, one here and one here. This is a C-shaped structure, and it's like a rubber. In simple words, it gives conformity to the knee and acts like a shock absorber. So if you were to twist your knee, really extend your knee, sometimes this meniscus can tear. If the meniscus tears, depending on its location, how symptomatic it is, how long you have had the injury, again, it can either be trimmed or it can be repaired. And then just one more injury to talk about, just like I was mentioning about the patellofemoral dislocation. Imagine you have a really bad injury where there is direct trauma. Sometimes what can happen is a piece of bone from the cartilage can crack. If that happens, we call this an osteochondral injury. And that piece can often get locked in the knee, causing locking, discomfort. And more importantly, if you've lost a big chunk of cartilage, cartilage doesn't really regenerate. So that can often either again require removal, or it can often even be fixed back. This is a very basic video of just the common injuries. I'll try and do a few more videos for my patients. And if there's anything else in particular you would like me to make a video on, do let me know, and it would be a pleasure to do so. Thank you so much.